So here we're going to talk about ammonia. We're going to talk about Streptococcus ammonia. Okay, first of all, Streptococcus ammonia. This is gram-positive diprococcal. What it looks like? Two of them stacked together. It's called a lancet shape. It's a diprococcal. This is a capsule, very heavy capsule. Okay, that's diprococcal, gram-positive diprococcal for Streptococcus ammonia. This is cost 80%. We call it a CAP, C-A-P. What that means? Community acquired this ammonia. Responsible for 80% of community-acquired ammonia in the United States. What are the symptoms? Think about what you have ammonia. Fever, cough, and chest pain. But remember, this ammonia usually for around 5 to 40-year-old. That is actually for adults. Okay, for older people, it causes ammonia. If it's, for adults, causes ammonia. If it's more than 40 years old, it's called meningitis. We just mentioned about that. But how about for kids? Okay, if it's younger, okay, less than 5 years old, this will cause something else. Otitis. Otitis, which means you have an ear pain, ringing, and the buzzing. Okay, that's otitis. But more important, because of this heavy capsule, for the young kids, what they're really going to have is bacteremia. Bacteremia, which means bacteria is in the blood cell, in your blood vessel. That's not good. So your bloodstream should be sterilized with any bacteria. So bacteremia, there is two sides. Number one called septicemia. C-E-M-I-A. Septicemia, which means the bacteria is gonna invasive, and they will be culturing and also will be growing there. So that's called a septicemia. But another one, which is we just call it a bacteremia. A normal bacteremia, which means it's only colonizing, not really growing. Okay, so there's a difference between that. But I tell you one thing, this could be very invasive because of the capsule. Now we do have a vaccine for that. That's called the PCV because we get it from the capsule. We mentioned about that. Okay, so that's something for Streptococcus ammonia. Now, how to diagnose? Remember on the slides, we have this blood agar. Okay, then we have hot one disc there. That's called a P disc. The component is called opticant. This is antibiotics. Now, Streptococcus ammonia, it will be sensitive, which means here is transparent zone, surrounded opticant. But there is other group of the bacteria can grow dramatically surrounding the P disc opticant. That is called viridine Streptococcus. This encoding Streptococcus mutans. Streptococcus mutans will cause plague on your teeth. We'll mention later. And Streptococcus bovis and Streptococcus mitis. Okay, now here's something I also want to mention. We write S here. This means Streptococcus. Later on, we talk about the Staphylococcus. It's going to also S. So I suggest you, when you first learning, write the STREP there. Don't confuse by yourself. Okay. Now, Viridine Streptococcus. This is a group of the Streptococcus, usually in the oral cavity. But what happened is it's very risky for the older people. So if there is a 60 to 70-year-old grandpa, then go to take out of the wisdom teeth. Now what happened? Sometimes bad thing happened, he will be died after like 7 days. If the oral cavities, the hygiene did not do very well, because this guy will cause endocarditis. Carditis. That is inflammation of heart valves. Okay? Of heart valves. So that's, be careful. Now because this one really exists in the oral cavity a lot. And then the Streptococcus ammonia causes alveolar infection. So sometimes when you get a sample from the tonsil area or from the sputum area, you may get confused which one is which. That's why we use optica, a P-disc, to do a quick test. Because Streptococcus ammonia is sensitive or susceptible to that. There is a transparent zone, so we say quite susceptible, which means sensitivity. And it's Viridine Streptococcus. Our slides use Streptococcus mitis. They will be resistant to the optica for the P-disc. Okay, so that is, we have everything for Streptococcus ammonia. Okay, so we will be really quick, talk about another one. Now we mentioned Streptococcus ammonia. This is 80% of the cap is ammonia in the United States. Then we have another one called Klebsiella ammonia. Klebsiella ammonia. This is the one, only 2% community-acquired ammonia. Very mild symptoms. But what happened is, this is really cause a big problem, is infant diarrhea, and urinary tract infection. We call it UTI, urinary tract infection. This pathogen, this is gram-negative, rod shape. So it will be grow on the McConkey agar. We're going to talk in the lab really detail what's McConkey agar. We mentioned already. And because it is lactose fermentation positive, so it is a pink colony. Now, of course, this will grow on the blood agar. You saw on the slides. When you see the McConkey on the blood agar, you see the colony. It is very heavy, looks like a cheese. Is that right? That is, we call it a mucoid colony. Because it also have a very heavy capsule. A mucoid colony, what happened? You have a cough. After cough, you're going to have like a currant jelly. The sputum looks like currant jelly. Currant jelly usually happens in the European country. We don't sell it here. Here, you can think about like a grape jelly. Did you eat breakfast? You have a sandwich? You have a piece of bread, you put a grape jelly there? The color looks like the sputum sample, if you get contaminated, infected with Klebsiella ammonia. Okay, something like that. This currant jelly is the one which is selling in the European country. Here we use grape jelly. So just to let you know that. That's a mucoid colony, very heavy like a cheese because of the heavy capsule. So that's Klebsiella ammonia, very briefly. You can go back to look at the slides. We have a McConkey agar and a blood agar, how it looks like. Okay.